have a challenging case. Patient with neck pain, cervical kyphosis, difficulty holding her head upright. And you can see how accentuated that kyphosis is. And even when she extends, she's still kyphotic. So she's tried a number of different types of non-operative treatments and just not getting significantly better. There's not a lot of port stenosis, but this is her lying down. When she sits up, that stenosis increases, especially the neuroforaminal stenosis. So this is a combination of radiculopathy as well as postural neck pain due to cervical kyphosis. And looking at this, there's multiple different options, but using a kind of a focal treatment option, we're going to fix 3, 4, 4, 5, 5, 6. That will give us the maximum amount of deformity correction and also treat a 5-6 level that has neuroforaminal stenosis and severe degenerative disc disease. We'll treat the other levels that aren't perfect, especially C5-7, non-operatively, which will be one and the same as the postoperative rehab. And in the end, I'm going to expect her to get really, really healthy and fit, because that is the complete treatment. Not just the surgery, but surgery followed by a really healthy, active fitness program. So we're all hoping for the best so that you can get back to a busy, active, precious life as soon as possible. Do you want to start? We are at the beautiful surgery center in Mission Valley Heights. Everyone called each other in the morning to make sure that we all color coordinated, so we're really matching. We love blue. There's that yellow scrub that Sanai's wearing. It's a little on the hideous side, but he pulls it off. So we're about to get started. We have about $1 million worth of equipment in here. But it still requires the Formula One driver to do a good job driving around the tracks. So we're going to do a perfect job so that we can get her back to our lifestyle as soon as possible using the latest, greatest, state-of-the-art minimally invasive techniques at the surgery center with all the latest and greatest equipment. And with the most awesome anesthesiologist on the planet who changed my life. He makes lots of videos and he told me, Choll, you need to get a lighting setup because you look old and all your wrinkles are obvious. Get a really bright light, maybe get like 4 of them, not just one. What do you think, Brad?
Not what I said. I think you look wonderful.
That's what he already said, but what he meant was what I said. Getting started. You have a very long neck, so I could make a perfectly curvilinear incision or horizontal incision. So I made kind of a curvilinear, half horizontal, half vertical incision. Because that's what I would do if it was me. And that is the overriding principle of how to do surgery. What would I do if it was me? Because I can't do any better than that. Can you focus in there by any chance? Despite the forces of evil, may I have the cassis? Oh, but your neck is so supple. Thank you for being young and healthy. Okay, may I have the peanut elevator and then the lightning bolt thingamabobber. So I try to put it in there. I'm almost positive that's 5-6 is the first big osteo fight. Now we just need to make our way north. There's the next disc. We're going to find out how strong you are, Kinsey. We'll stop and just control the bleeding because I abhor a mess. There's always a little bit of bleeding right here. I'll take the bone wax on a kidner, just kind of flat. You see it? Oh, April, perfect works. Nuisance, get me. All right, let's go back up. Here is your half by half. Please keep track of it so we don't have to do the dumpster dive at the end of the day. Be really careful going laterally on the longest coil like that, Jen. Is this the top? It sure is. So I did. I have the bleeder on the exact bleeder on the other side, so I need the Surgery flow. 2 kidneys. Then the bone wax. Ooh, yeah, now we're running. I'm about to do the end plate prep. I'm going to collect some bone, a local bone graft. I usually scoop it up with a little spoon, which is so old school, but check this out. It's in line with my suction, so all the bone dust will be collected into this bone collector. Of course, Stryker makes it because they make everything, and they're going to basically take over the world and enslave us. But besides that, I love Stryker. And I don't have to use a little spoon to collect all this bone dust. Chilo. How's the patient doing? Oh, you guys can't see in here. Okay, I'm at the second level. Oh, by the way, have we been calling the family? Second level. You have such a beautiful supple neck. This is like a total pleasure so far. Because it really is the little things that keep you going. I think I talked to you about this already. All right, last level. Things are going beautifully. I'm going to now put in lacage. That would be French. So this is one of the state-of-the-art implants. It is a hybrid implant. The plate is integrated, so it's zero profile. It doesn't stick out like a big rock in your shoe. I've got the world's greatest bone graft in there. I've done the world's greatest exposure, saving the longest Choll muscles using the minimally invasive retractor. All I need now is 2 snaps and a twist. Putting cage in, everybody. Raise your glasses for a toast. Right, here's the Stryker bone collector. There's not much bone because it's a cervical spine, but I collected everything without me having to scoop it with a little spoon, and I'm just going to push out the contents. Look away because it can be kind of gross. Holy cow. That's not a little bit. I would say that constitutes as a lot of bone graft. Why is it so dry? There's nothing else in there. Wow. Look at that. And I was like, I don't think that's going to do anything.
Watch your head.
Is this water? Ooh, nice, Kenzie. The hard part now is with the screw. You see that screw? Oh. Head, hole. The hole right there. Oh, Jesus! That went really, really, really well. So thank you. Surgery's all done. So here's the pre-op x-rays. I don't know if you can see well how the spine, instead of going back like this, it's going forward. Bending forward like this into kyphosis, and we want to go into lordosis. So that's the pre-op, kakapupu kyphosis. And here's the post-op. Oh my goodness, look how tall each level is. It's much straighter. We're going to really work on improving the strength of the muscles in your back so you can keep on pulling yourself back to a more normal position. Here's the frontal view, right down the middle. It's perfect. You're going to feel taller, stronger, faster. better, quicker, sexier, and everything else that you deserve. So best wishes on a speedy recovery.